Hello guys. So this is what our device looks like, and this is a non-invasive AI-capable COVID-19 detector. It is supposed to use thermal imaging to be able to detect various uh, various anomalies and various factors that can help a doctor or that can help us detect whether or not a kind of infection is there inside the lungs or whether or not the organs are like exerting more strain in that area. So uh, as we know, the problem of COVID-19 has been like very immense, and it is like growing day by day. And we you can check on the net. There are many papers available that state that the COVID-19 affects the brain, heart, lung, and liver organs. So right now there are very few COVID-19 test methods available, and most of them are like chemical tests like RT-PCR, or they are DL based tests like X-ray, like those deep learning algorithms that work on X-ray images and CT scan images. So for COVID-19, they basically use X-ray images. So for these images also, a sophisticated X-ray machine has been like has to be utilized to collect the X-ray, and this also requires a lot of medical expertise, and not everyone can actually carry out so many X-rays when the medical domain is uh, so affected with treating the patients, and so many patients are involved. So uh, our thermal imaging module is a novel and easy to apply DL solution that does not require such kind of sophisticated machinery, but instead uses thermal imaging modules. So these are the features that we are going to provide. There is no bulky machinery required. There is no CT scan or X-ray needed. The data collection and analysis is done by the device itself, and like it can store new data, new images. The edge device is inside the device itself. It is portable completely. There is no medical expertise required to use the device. uh, it can like it can be used by any person. Even surveillance people can use it, and one single person can actually operate multiple such devices. So very less manpower is required to run these devices. The detection is quite fast. Once the model is ready, the detection period will be around 1 to 3 minutes per patient or subject at max. It is easy to use, portable. It is non-invasive, so there is no kind of like it can be completely remote controlled, and there is a particular separation between the camera itself, like the device itself, and the person that is being scanned. So there is approximately like 2 meters distance that is like required. There is no person that needs to operate the camera. It can be remotely controlled by someone sitting in some other room. And as it involves passive scanning, there is no radiation involved. It The device itself is taking only the IR radiation that comes from our body, from our skin. Uh, the problem with other medical tests that detect COVID-19 is that they don't have much application beyond this detection application. So in thermal imaging, this device can directly be used as it is in other domains like surveillance and fault checking. So you don't have to change the device, you just have to change the model, and that's it. You can directly use it even after the pandemic is subsided or like settled. Uh, and as I said, it is remotely controlled, so Wi-Fi connectivity can provide remote control. So this is how our device is designed and it looks like. It has a Wi-Fi module. It has a thermal imaging camera with a breakout board. It has two UVC LEDs for decontamination of the device itself. Thermal vents are placed in such a strategical manner such that they don't interfere with the readings of the thermal device, the thermal camera. And our main edge computing device is the Jetson Nano. So it is a very cost-effective solution, and the Jetson is like cooled by a 30 fan, which is like quite cheap. So our entire module is like the casing of our entire module is 3D printable, and like we can easily produce one single uh, one single set of required casing and stands in a single day per single device, like per single 3D printing device. And we have two variants, like we are planning two variants. One will be with like with access to the USB ports and all the cords and Ethernet, and one will be a deployable version that will like prevent connection to these ports for extra security. And as you can see, the thermal camera has a like the thermal camera is here and it has a slot. The maximum dimensions are 129 into 85 into 33 cube, so that is pretty small and sleek. So this is our timeline. uh, we have begun our research and like we are almost done with our POC. We will be now starting data processing and collection, as we have almost procured all the components. So we have the Jetson Nano SBC and we have the thermal camera breakout board. We will be getting the thermal camera itself by the next 1 2 weeks. So our deadlines have been extended by around 1 month, but that's almost that was almost taken care of, like considered actually beforehand. So our next step will be to approach government bodies once we have developed the first prototype, and uh, with their support, and we have also talked to some foreign people and foreign open bodies, like the healthcare engineering, so helpful engineering. So basically these bodies, they promote COVID-19, they basically promote COVID-19 open source devices and projects that can like actually help curb and control this pandemic. So basically, we have approached these people, and like we are trying to build a worldwide data set on a thermal imaging, on thermal images, specifically collected for medical data processing. And once this data is collected from variety of nations and sources, the software development and product development will begin. And after that, if once we see some kind of promise and accuracy, we will be applying for certification and patents, and we intend to pilot launch in after August. So roadmap till now. The business, our key partners are related to hospitals, medical firms, surgeons, and thermal imaging and AIDL companies. The key activities include procurement and import, because most of the components are not available in India, they have to be imported. Thermal imaging is a bit of a costly process. Like once it is made, then it has a lot, it is a long term benefit model. So basically, first you have to invest a bit to like procure, like to make the device. So we require some funding to develop the prototype. And data collection is obviously important because as you might have seen, right now thermal imaging is only being used for body temperature scanning. So we think that thermal imaging can be used for like knowing a lot more about the body. So we are like uh, trying to develop a new kind of data set or new kind of field, a new kind of application basically of thermal imaging that can that proves that thermal imaging can be used in a much more efficient and better way. So for that, like there is no open source and no such kind of data set available right now. So we will be like we are, as I said, trying to build our own nation like worldwide data set, diverse data set. So we are like open to any kind of support that you can provide us. We will be then applying for patents and certifications in case we get a breakthrough. Our key resources, as I mentioned earlier, is data, the thermal imaging modules, the server databases, and licenses and certifications. Our value propositions are mainly related to our features. So fast results, no special machinery required, medical skill is not required, portable and compact, and remote control, no radiation involved, versatility. Versatility is something that I would like to stress upon because most of the things might go out of demand once the pandemic ends because either they have been mass produced too much or they are very specific in their application. This device is a bit different. It can be used in a variety of fields as you will be seeing later. And the novel part is that if it is correctly developed, then it might also track the spread of the virus inside a body. Customer relationships are basically related to online publicity and word of mouth of surgeons and users. The channels basically are the same module sales and to the hospitals and government bodies, online websites that will offer our hardware services and software services. uh, our customers will include these so many domain people once the device is developed. Right now we are focusing on medical diagnosis. Afterwards we might also extend to other areas. The cost structure is basically mainly involving a capex. Basically, as I said, that thermal imaging requires a lot of cost and like a lot of uh, requirement of like basic income before we can actually start developing a software and start developing the hardware. So to build the prototype, we require some amount of money. The labor and payrolls, the certifications, R&D, etc. They will be the main uh, sources of costs later. And our revenue streams are basically data sharing, medical diagnosis services, our AIDL models, and the people who will be buying our hardware or leasing them, and also some people who might require custom AI model development. So this is the market analysis. Thermal imaging is a unique market right now because the COVID-19 has only been promoting the growth of this market instead of curbing it in like is the case in other markets. So there are a lot of sectors of applications as you can see here: drone surveillance, fault finding, structural integrity checking, medical diagnosis, defense applications, and airport checking. So thermal imaging is a good market to invest. This is what uh, our cost incurred and recovery method pie charts look like. And as I mentioned earlier, the hardware costs and the patenting costs are the main cost that will be incurred. And we intend to recover these costs by our data sales, data analysis sales. So we are trying to develop our own like our own data set. So uh, we intend to recover mainly using that, and hardware devices and the service models will be the other sources of income. So here we are a team, like we are a team of two people currently, and there are a lot of people working with us right now, but we are we both are the main innovators behind this concept. we have like represented India internationally and nationally also in multiple competitions, and uh, we think that our experience and we like to think about new challenges. So uh, we thought of using our brains to like help India tackle this problem, and not just India but also the world. So uh, we are trying our best to at least develop some kind of novel device, and uh, we share a combined expertise of electronics, mechanics, AIML, and coding, and we have led multiple people and multiple number of teams. So we are trying to make this a commercial product, and we intend to like complete develop our own company and like find our own company by the end of I think August once our semester ends. So in case you have any questions or you would like us to like you would like to contact us or support us or in any kind guide us also, then like you can just take a screenshot or basically a print screen of this page, and you can contact us on LinkedIn, and these are our numbers and email IDs. So that's it. If you have any questions, then I would like to know. So, Komajan, ma'am, is asking that what kind of challenges will be facing with this application. So the main challenge is that firstly the resolution of thermal cameras are quite less compared to visible cameras. So we have tried to solve that by researching a lot, and we have found that 320 cross 240 pixel cameras, thermal cameras, are pretty pretty useful in medical imaging, and there has been a lot of work going on in using these resolution cameras in detecting tumors and skin lesions and all that. But right now there has been no effort that is being going on to detect some kind of respiratory or internal disease. So we are trying to use thermal imaging for those applications. And apart from that, the second problem is that thermal imaging cameras have a lot of like a high amount of inaccuracy, you can say. So it is around plus minus 3 degrees to plus minus 5 degrees Celsius per pixel. So that might pose a problem, but that is a maximum for the error that is there. Basically, if proper care has been taken, then the amount of error is much less. And we are working with thermal imaging experts that can help us develop a method to collect these images in which the thermal imaging error per pixel is very less. And the main other problem is that since these cameras are quite costly, there are very less open data sets available for employing these type of models. So we have to like make an extra effort and collect our own data set. And since we intend to make a deep learning model, we require a lot of data. And for that, we are trying our best to collect as much data as possible from various nations and various backgrounds. So that's it right now. Those are the only challenges that I think is related to thermal imaging employment. Any other questions? So, uh, I guess in case you would like to ask us personally or mail us, so you can feel free to mail us on like I'll be including our profiles inside the description section. So you can just mail us, you can ask us more about this project, and you can support us in any way possible. And we specially require people who can help us gain permissions and data and like help us with procurement of these thermal devices. So thank you for joining us, and uh, we'll be holding more such sessions as and when our device progresses. So thanks a lot for joining in.